BFR is a growing trend in the rehab and reconditioning fields, and rightfully so, because it works. We've been utilizing it at Rehab to Perform for the last 6 years and have seen tremendous patient outcomes. Our clinicians love it, it's easy to implement, and it makes the sessions more fun and more enjoyable. So what is BFR? BFR stands for Blood Flow Restriction Training, or you may hear it as Blood Flow Restriction Therapy, depending on the setting that you're in. And really what it is a way to reduce blood flow to the exercising muscles to make really basic exercises feel pretty challenging. Now, why would we want to do this? Because after an injury, one of the main things that we need to do is we need to regain strength. Unfortunately, a lot of times strength training may not be well tolerated because of pain. Or we may have a surgical or some sort of post-injury precaution where we're just not allowed to do certain strength training movements that would allow us to get those gains that we're trying to see. And that's where BFR comes in. So how does this work? Well, it's pretty simple, really. You're gonna put something on that looks like a blood pressure cuff, and it's gonna go on the high part of the leg or the high part of the arm, depending on the injury that you're dealing with. You then inflate the cuff to a certain percentage, and I'll show you how we do that later. But you're trying to reduce the blood flow to the leg or the arm. Now, blood carries oxygen. So if we're restricting blood flow to a muscle, we're also restricting oxygen to a muscle. So even if we're doing a very basic activity that we would normally just use our aerobic energy systems for, which uses oxygen as the energy source, we don't have that option because we don't have enough oxygen there to support the task because the blood flow is being reduced. So our body has to go to the next available energy system, which is anaerobic. Now, the cool thing about BFR is because you're operating at such a lower intensity with exercise, oftentimes you're not breaking down the muscle like you are with traditional strength training. So when you do traditional strength training, you often get that delayed onset muscle soreness the following day. With BFR, that muscle soreness is often reduced or even absent because you're not doing very strenuous exercises. It just feels strenuous because of the machine. So BFR has been an absolute game changer for us at R2P. It's being utilized all throughout the rehab world and in strength and conditioning settings. And there's a variety of different pieces of equipment or brands that you can utilize, ranging from very low tech to high tech options. Some are a little bit more hands-on, some are a little bit more independent, some are more or less portable, but there's a variety of ways that you can do this in different settings. At our facilities, we find ourselves using this for a variety of patients. And we had talked about earlier, it is for people who would benefit from strength training, but maybe they don't tolerate the strength training or they're not allowed to do the strength training in a traditional sense. So this is oftentimes post-operative patients. Think about an individual who gets a knee or a hip or an ankle surgery and they're not allowed to put weight on their leg for a certain amount of time. If we're not walking and bearing weight with just everyday activities, we're gonna see a very quick atrophy of the muscles, and BFR helps reduce or even mitigate that risk. Other things that we have seen this with is people who have fractures, people who have had muscle strains, even people who have had tendinitis or bursitis, and they just have a hard time doing your traditional weight room activities. So now we know what it is, we know why we use it, how it works, and who we use it for. Let's take a look at what an actual session looks like. All right, so we have got the BFR cuff on. We are using the Delphi system, and this is through Owens Recovery Sciences. This is where we did all of our continuing education and certifications through, and it's a pretty easy to use machine. The cuffs come in different sizes, ranging from small, medium, and large, and whether you're using a leg, an arm, and the size of the individual is gonna dictate that. The machine is pretty cool, so you can set it by the time, and you can pre-record a time that you wanna utilize, and then you can also dictate the pressure that you want it at. So typically what you will do for the pressure is you will run what is called the personal tourniquet pressure. And this is gonna have the machine turn on and inflate the cuff to figure out how much pressure it takes to actually fully restrict blood flow. Think about completely kinking a hose so no water goes through. Then what you'll do is you'll set the machine to just a percentage of that. For lower body injuries, you never go above 80%. And you may not start at 80, you may start low and work your way up after sessions. And for the upper body, you never go above 50%. So the cool thing about these machines is when we turn it on, you're gonna hear it making some noise. And what it's doing is it's actually pumping air in and out of the cuff so that as I'm moving around, it's maintaining a constant and steady pressure. And that's important because the muscle is gonna be contracting and relaxing. We're gonna be standing up, laying down, changing some different positions, and the machine is gonna make sure that we're staying in a safe range to do all of that. Now, the next question is, well, how do you do the program? What do you have them do for this? And the nice thing is, regardless of what your program is, whether you're doing it for time, whether you're doing it for reps, the literature shows it works no matter what. Now, the more that you can dial in your program for what the patient can tolerate, and you can get as much bang for your buck in regards to exercise efficiency, is always going to be helpful. A lot of the research centers around doing maybe 1 or 2 or 3 exercises and doing a high volume scheme where you do 30 repetitions of the exercise, then you take a break, and then you do 2 or 3 sets of 15 repetitions again after that. Another strategy that you can use is you can pick a list of exercises, think 3, 4, 5 different exercises, and you can set it up like a circuit. So you can have the individual work for 30 seconds and then rest for 30. And then work for 30, and then rest for 30. What I like about that is as it gets easier, you can make the intervals more challenging. You can go from 40 seconds of working and 20 seconds of resting to 45 seconds of working and 15 seconds of resting, and make those intervals a little bit more challenging for the individual. You can also make the time frame longer. So maybe you're doing 2 rounds or 3 rounds of exercise as you get more comfortable with it. So I've got the machine already set up. All I got to do is hit inflate. So I'm going to do that, and then we'll start off with the first exercise on the ground. So a common exercise that we'll do for a lot of knee and lower body injuries is called a quad set. And all I'm doing is just with my left leg that's out straight, I'm flexing and relaxing my quad, or that front of the thigh. This is a muscle that often atrophies and gets smaller and weaker after big surgeries or after big injuries. And this is a great way to help recruit and activate that muscle. Early on, you often do this without BFR. This is an exercise in and of itself where the individual is just trying to isolate the muscle. Usually that gets pretty easy after a couple sessions, after a couple weeks. So the BFR is a great way to make that simple exercise more challenging. Now, another thing that's a benefit to this, especially with knee surgeries, if you have an incision that's going across the front of the knee, bending and straightening the knee may be a little bit uncomfortable. So when you're doing some of your early exercises with BFR, you may find that you are often on a table or lying down as opposed to standing up. You'll see when we stand up, I am then going to have to work against gravity. And the cuff is making it very challenging for the blood flow to go back and forth. But when I stand up, it's going to be even harder. Now, we can pretend that I just did that for 30 seconds. Now I'm going through my rest break. So the next exercise that you may see would be something like a straight leg raise. So with this, I'm lying down. I have one leg bent. I have one leg straight. And now I'm not only squeezing the leg, but I'm lifting it up and I'm lowering it down. This again is something that's typically used pretty early on in rehab, but at a certain point it gets too easy. Now you could put an ankle weight on or put something lower on the leg to increase the weight, but the BFR makes it pretty tough even without doing that. Again, the knee is straight, so if you have an incision, you're not putting any extra stress on the incision. But now instead of just doing a static activity, we're raising and lowering the leg. It's getting pretty tough pretty quickly with this. Now, one thing that you'll also note is I'm still lying down. So we've done 2 different exercises where we're lying down. And after this, we're going to get up onto our feet. So I'm going to do 2 more reps. After that, take a quick rest break, and then I'll get up onto my feet. So now I've transitioned to calf raises. The big thing here is we went from being on the ground or lying down to being upright. So we talked about different populations where you may not be allowed to be weight bearing or being on your feet. So obviously we're assuming that I'm a patient that would be able to. But calf raises often aren't that challenging with just your body weight. You typically need to add dumbbells, a barbell, some sort of machine. The BFR is a great way to make this simple exercise more challenging. I'd mentioned earlier, now that I'm up against gravity, the blood is trying to go up and down against gravity in addition to the cuff. So what you may see, and they call this the cell swell, is you may actually see the leg start to get a little bit bigger and it looks a little bit more full. That's going to enhance some of the challenge as well. It's going to make the muscles fatigue a little bit more, and it's going to make those nerves that connect to the muscles try to become a little bit more efficient, and they're going to recruit some of the other surrounding nerves to help make that muscle fire completely. All right, so now we're on to the fourth exercise. I'm going to do a squat variation. It's going to be more of a sit to stand. So I'm in front of the bench, and I'm just going to lower myself down, completely sit, and then stand back up. So with this, similar to a squat, but we are having that little rest break at the bottom. And with the BFR, because it's around the leg, going all the way down through a full range of motion may be a little bit more challenging. So you may have to reduce the range of motion just to make it more comfortable. But we have a lot more going on with this exercise. We're weight bearing, we have hips, knees, ankles bending, we have a lot of big muscle groups involved. So the muscles will fatigue pretty quick. Now you could just do more of a traditional squat and go up and down as well, or even hold a small weight and do a goblet squat or something a little bit more resistance. Keeping in mind, as we get into higher level activities, we start doing squats, we start doing things that look more and more like strength training with the BFR, and we're able to do it with some weights, you're going to hit a point where you'll just naturally transition away from BFR and just back into the weight room. Now, typically BFR is used in the beginning of phases of rehab. You can also use it towards end phases of rehab with people who are relatively healthy and doing very well, and you can do it to isolate and burn out muscles at the end of an exercise routine. So that may be somebody who is in the gym, they're doing squats, they're doing deadlifts, they're doing lunges, they're doing step-ups, and they're doing all of that regularly in the weight room. Then they put the BFR on and they do some of those earlier exercises that you saw me do, where they're isolating the quads, or they're isolating the calf or the hamstring, and they're trying to regain whatever that last little bit is that they still don't have. So that's BFR and a little glimpse of how we would utilize it in a PT session. When clinicians ask me at different events or in different professional settings, what is BFR? The answer that I always give them is it's a way to mimic the metabolic demands of strength training without the mechanical load. When patients ask me, what is BFR? I tell them it's a way to make really easy exercises feel really hard so we can build muscle. Regardless of how you explain it or how you define it, BFR works. It is a tremendous tool in the PT clinic and in the strength conditioning world. And if you are suffering from an injury where you have a loss of muscle size or muscle strength, ask your PT if they have BFR and if you can start incorporating it into your program.